Good evening, everyone. This is Dr. Sai Santosh, and today I'll be discussing you about space infections and clinical scenarios. So, So before we go ahead in the lecture, I'm sorry for the interruption for a second. I think the first dissection of the head and neck was shown in the year 1851. Okay, in exhibition in England. Okay, so this is one picture of historical importance. So you can see there there is dissected head and neck and region, okay, of one side. Okay, and the importance of this picture, why I kept this, just to remind you of one thing. When you're reading about space infections, make it a point you go back and read your anatomy as well. Okay, so if possible, what I'll do is, this is a lecture on only the clinical scenarios of head and neck space infections. So for the next lecture, what I can do is, I'll just put up some anatomy. I'll discuss how each space communicates with each other. I'm so sorry. Okay. So each space, how it communicates with each other, and how is it clinically significant for us. So these are particular things what I'll be discussing in the next lecture. But this lecture, in nowadays in the NEET exams, you see a lot of clinical scenario questions. Okay, you'll see a lot of questions based on the topics, like there will be like a clinical scenario or a clinical situation they'll give, and they'll ask you what treatment will you give in that situation. Or there can also be a flow type of questions. The flow type of questions are like, they'll give you one clinical scenario, okay, and then they'll follow with three or four questions on the same clinical scenario. Okay, so these questions usually used to be in the initial comet k days. Comet k days are when we used to prepare for our postgraduate examinations. We used to have 180 questions for our comet k, okay, examination, that is conducted by Karnataka private colleges. Okay, RGHS private colleges all. So in that exam we used to have a clinical scenario, and they used to follow up with three or four questions. Even the NEET may come up with such pattern of questioning. Okay, so we'll go ahead. Today's class will be exclusively on clinical scenarios. Before going ahead, I'll just discuss a small basic point. Okay, see the question there. I want everyone to be interactive. Is my voice audible now? Clear now? Yes. So it's clear now. Okay, good. Okay then. Okay. Hi everyone, whoever has joined here. Jaydev, hi. Varsha, hi. Pargavi, Shruti, hi. Shubham Das, hi. So Vaishnavi, hi. So good to see everyone joining now. Okay. So let us start being interactive now. Okay. Hi Aftab. Okay. So name the layers of phase from 1 to 5. Okay. Can you see the picture there? Oh, hi Pravati. Yes. So your dentist, someone has named. Hi. Okay. So name the layers of phase from 1 to 5. Can you see the layers there? Okay. So come on. You studied about the layers of scalp, right? So what are the layers of face here? So it's wonderful seeing so many people joining for the classes, and it actually motivates us a lot to do this. So come on, let us go ahead now. 1 to 5. So any ideas? Can anyone tell 1 to 5 what they are layers? A question may come for you, a picture based question like this, okay, and they might ask you, okay, they're coming up with innovative type of questioning, okay, so we also have to be innovative now, okay, we also have to start thinking more, okay, along with studying we also have to think new ways of answering such questions. So anyone? So I think, see, everyone has answered number one. Okay, skin. Okay. Some has answered number two. There, some has told superficial fascia. Some has told so subcutaneous layer. Okay. I think now Bhargavi has told skin, subcutaneous, aponeurotic layer, loose areolar tissue, and deep fascia. Okay. Uh, Okay. Oh, okay. Prabhavati has answered that, and Bhargavi has answered skin, superficial fascia, platysma, and deep cervical fascia. Okay. Okay. So your dentist, someone by name your dentist has answered skin, subcutaneous layer, musculoeponeurotic layer, loose areolar tissue, and fixed periosteum and deep fascia. Okay. So can anyone answer this? Then anyone else wants to add up on something? Okay, we'll go ahead with the answer now. Okay, so let us see the answer now. What is this? The first one is the skin. Okay, the second one is a subcutaneous layer, and the third layer is the musculoeponeurotic layer. Okay, there is something known as superficial musculoeponeurotic system (SMAS). Okay, please note down superficial musculoeponeurotic system (SMAS). Please read about this layer. Okay, you may well encounter a question on this layer. This is something new terminology for you people. SMAS on face. Okay, so then the fourth layer is the retaining ligaments and space. Okay, and fifth layer is the periosteum and deep fascia. Okay, so I hope everyone is clear with this, right? I'll give you 2 minutes. Please revise, write down whatever I've told you now. Okay, remember these layers really well. Okay, so gone are the days where they are going to ask you layers of scalp that they'll ask only in the first year videos. Okay, now they're asking about layers of face now. They'll start asking about you about the layers of face. Okay, so skin, subcutaneous, musculoeponeurotic, retaining ligaments and space, and periosteum and deep fascia. Okay, so okay, so let us go ahead with the next question, right? Can I have everyone in the chat? Can we go to the next question? Okay, so let us go to the next question here. Arrange the following in the correct sequence: cellulitis 1, inoculation 2, 3, abscess. Okay, I see a lot of people are answering here. Good to see a lot of people answering. I think Prajakta has first answered 231. She has answered. Okay, that is one answer. Okay, so then now Prabhavati has answered 213. Okay, a lot of answer. Akshita has answered, Shruti has answered, Jayadev has answered, Nikita. Uh, it's great to see a lot of people answering. Okay, I'll get back to you with the answer for sure. Okay, so if you see any infection, okay, uh, be it bacterial or fungal or viral. Okay, we have been discussing a lot about COVID 19 nowadays, right? We have been discussing a lot about COVID 19. Okay, so in COVID 19 also, the COVID virus or whichever virus is there, okay, it first undergoes inoculation, right? Similarly, the bacteria also undergoes inoculation, okay? Then it goes into a stage of cellulitis, okay, and in the third stage it will go to the abscess stage, okay, where pus will be present and we can drain the pus out, okay. So in the abscess stage pus will be present, okay. Cellulitis stage has pus, true or false? Can I have the answers here in the chat? Is it true or false? Cellulitis stage has pus. Exactly, exactly. Great that everyone has answered it right. Cellulitis is one phase which does not have pus. Okay, I see a lot of local dentists calling me around. Okay, and telling me, I just had a call in the morning. They were telling me, sir, come and drain the pus from this cellulitis patient. Okay. So what we advise is let it go into the abscess stage so that we can drain the pus out. In cellulitis stage, how much ever you try to drain, there won't be any pus that is coming out. So no use of draining an patient during cellulitis phase. Okay. I hope this concept is clear to everyone. Okay. And this is one concept which might help you really well. Okay. The first one is inoculation, then is the cellulitis, and then is the abscess. 213. Okay. So answer is C. Okay, it's good to see a lot of people answering the correct question, and whoever has answered the wrong question, okay, never get upset. Okay, you still have a lot to learn. Just spit out the wrong ones and accept the correct question so that it will be stored in your mind really well. But make sure that you answer correct or wrong, because when you are answering something, even if you answer it wrong, and when some correct question comes out from my mouth, you'll remember it better, okay, than not attempting. Okay, if you're not attempting, you'll never remember the correct questions. Okay, so just remember that. Okay, so now the voice is clear. Sorry, is there any echo now? Okay, now fine. Okay, thank you. Okay, clear now. Oh, great, great. So, okay. Okay, we'll go to the next question now. Okay, now we'll start with the clinical scenarios. Yes, Jaydev, the answer is first is inoculation, then cellulitis, then is the abscess. Okay, answer is 213. Answer is C. Okay, okay, Jaydev. We'll go to the next question about the clinical scenarios. Okay, uh, let us see this patient first. 55-year-old patient complaints of swelling near his chin, and pain of lower anterior teeth since 3 days. So, what is your diagnosis? A. Buccal space infection, B. Canine space infection, C. Submental space infection, and D. None of the above. Please take time, okay, in seeing the picture first, okay, then read the question nicely and then answer, okay. I expect everyone to read the questions nicely first. Okay, anyone else wants to answer? Okay, if you see the picture there, okay, you can see a swelling near the chin region, right? There is a swelling near the chin region which is looking very erythematous, okay, and okay, which is looking very erythematous. And I've also given an other clue there, okay, pain of lower anterior teeth, infection spreads to which space exactly? Lower anterior teeth infection spreads to submental space. Okay, so the answer is submental space infection. Okay, so always see, I saw actually most of them has answered this question right, submental space infection. I think two or three people has answered it as none of the above, or some has answered it as canine space infection. Okay, please read the question a couple of times. Okay, always read the question a couple of times. Take time to answer always. Okay, there is always a clue in the questions which we give in the examinations. Okay, so lower anterior teeth pain is there and swelling near the chin. Okay, the most probable answer is submental space infection. Okay, so we'll this is a series of questions now. Okay, the same patient, when he reached abscess stage, I drained the pus out. Okay. Okay. Is the echo now better? Is it better now? Okay. So what is the method of incision and drainage called as? This is the same patient. Okay. So what I did was I just allowed the patient on antibiotics. Okay. Then when he reached the abscess stage, I drained the pus out completely. Okay, so when I drained the pus out completely, so what method do I use? So excellent to see everyone answering Hilton's method. Okay, now the next question is, which number BP blade do you use to mark an incision in Hilton's method? Excellent that everyone is answering. Number 11 BP blade you use in the most dependent part. Okay, Vaishnavi, it is not number 15. Ideal blade what you use is number 11. Okay, that is why I want to clear all your assumptions, whatever is there. Okay, number 11 is the ideal blade, BP blade, what we use for incision and drainage. Okay, so Is my voice okay now? It is still going. Okay, fine. So the same question, this is a series of questions that is following now. Which of the following is significant in culture sensitivity tests? Now I've drained the pus. Okay. Now I've collected a swab. I've collected the pus with a swab and I've sent it for culture sensitivity test. Okay. So which is significant in a culture sensitivity test? Is it A, maximum inhibitory concentration of drug, B, number of bacterial colonies, C, duration of infection, D, minimal inhibitory concentration of drug? Okay, I just removed my earphones now. Okay, is my voice better now? Can I have your opinion in the chat? Is my voice better now? Okay, it's echoing more. Okay, then I better use the earphones, right? Okay. Okay. So I think everyone has answered this, or is there anyone more to answer? Did everyone understood this question right? Which of the following is significant in culture sensitivity tests? Okay, so the patient has come to us. Okay, um, we have identified the infection as submental space infection. Then we have done an Hilton's incision and drainage. We have collected the pus. Then we have sent it for culture. So which is the most significant thing in a culture sensitivity test? Okay, so the answer is D, minimal liquidity concentration of the drug. Okay, the answer is D. Okay, so whenever you send a patient for a culture sensitivity test, the most important thing what you check for in a culture sensitivity report is he will give a dozen drugs there. Around 10 to 11 drugs he will give, and he'll outline the minimal inhibitory concentration of each drug. Okay, so whichever drug has the least minimal inhibitory concentration, that drug we can give to that patient for the infection to subside. Okay, so yes, to check drug resistance probably. So that is one important thing. Yes. Okay. So answer is D, minimal inhibitory concentration of drug. Okay. So let us go little ahead now. What is this drain called as? Check this drain. Okay, what is this drain? Okay, now that we have drained the entire infection, we have placed a drain and we have stitched. We have put couple of stitches there. Can anyone answer what this drain is called as? Can I have more answers, please? Anyone else wants to answer? So, okay, let us go ahead. See, the drain, what you saw there, okay, is a corrugated rubber drain. Okay, yes, Shruti. To be more specific, it is corrugated rubber drain. Okay, many of you has answered it as Penrose drain. Okay, please check in Google what is Penrose drain. Penrose drain more looks like a tube of rubber. It is more like a tube. Okay, it's tube of rubber. It is also made of rubber, but it is more like a tube. Okay, and this corrugated rubber drain is not a tube. It is like an open rubber sheet which we cut. Okay, then we place inside. Okay, so that is called corrugated rubber drain. What we have used there. Okay, please note down in your notes. It is corrugated rubber drain. Okay, fine. Okay. Bhargavi, I hope this is clear. Okay. A latex strain probability looks again in a different way. Okay. If you want in the next class, I'll keep a couple of drains and I'll discuss what each drain looks like. I think that may help you people. Okay. So I'll remember this. I'll make it a point and I'll discuss in the next lecture about how each drain looks like. Okay. So next clinical scenario. Okay, this is exciting, right? This is good. Okay, so let us see next clinical scenario. Double chain. Okay, I'll put each picture of each drain. Okay, picture of each drain, and I'll explain you in the next lecture for sure. Okay, how a Penrose drain looks, how a corrugated rubber drain looks, how a K90 drain looks, okay, and then how a actual vacuum suck drain looks. Okay, so there are many kinds of drains that can be used. Okay, so I'll explain you about the drains. The next lecture I'll put various pictures and explain you. Okay, so let us go with the next clinical scenario here. Take some time. Okay, take some time, read the question first. Okay, 55-year-old male patient reports to the emergency with complaints of difficulty in breathing, both like swelling of floor of mouth, and tooth pain. What is your provisional diagnosis? Okay, I've given already. I've given the answer on the slide, so nothing to worry for you people. Okay, it's straightforward because the coming question is challenging for every one of you. Okay, because this is the most confusing question, the coming question, and the most controversial as well. People are fighting for this question since long time. Since the time when I started giving my post graduation, this is the same controversy that is going around this question. Okay, so let us see the next question. Okay, okay, let us see the next question now. Preferred treatment of choice for patient with Ludwig's angina at emergency. Preferred treatment of choice for patients with Ludwig's angina at emergency. Incision and drainage, tracheostomy under general anesthesia, cricothyrotomy, tracheostomy under LA. I want everyone to answer this question. This is the most important question. take some time. Okay, answer the question. I need everyone to answer this. Okay then. Diya Ghoshal, Varsha Rai, and Dhaval Jain, Vikas, okay, and Vaishnavi, Ruchi Gupta has answered it as C. It is the right answer, cricothyrotomy. Okay, why? I'll just tell you why it is. Okay, so remember for any patient with Ludwig's angina, okay, for any patient with, yes, Bhargavi, it is cricothyrotomy. For any patient with Ludwig's angina, the first most important for us is not draining the pus. It is never draining the pus. The first most important thing for us is securing the airway. Okay, it is securing the airway. Why? Because the patient will already have breathlessness. Okay, he will already have dyspnea. Okay, or difficulty in breathing. Okay, when the patient already has difficulty in breathing, his saturation or SpO2. Now that COVID has come and everyone knows what is SpO2, right? Okay, so his saturation will fall down. It will be 80, 70, 60, it will be falling down. The first most important thing is secure his airway first. Okay, so eliminate the first option, incision and drainage. Eliminate it. Now to secure the airway, we have various options. Either we can do tracheostomy or we can do cricothyrotomy. Okay. Tracheostomy, the main complication what happens with tracheostomy is because the infection has spread to our neck now. Okay, it has spread to our neck, the infection. In case if we rupture a colony or if we poke a colony or something when we are doing the tracheostomy, it means the entire pus will get aspirated and the patient will die because of aspiration. That is one complication of doing a tracheostomy in Ludwig's angina. Okay. So the next thing is cricothyrotomy. Cricothyrotomy is something like they'll just pass a small needle. Okay. They'll just pass a small needle. Okay, that needle they'll just enter the neck part here. Okay, this neck part here they will enter by seeing in an ultrasound. They can also use an ultrasound to penetrate the trachea directly by using a needle, and through that needle they will deliver oxygen. So less invasive, okay, and less conservative. Okay, I hope everyone understands this. So tracheostomy it itself is life threatening. Yes, dear. Yes, tracheostomy itself is life threatening. Exactly. So the answer is cricothyrotomy. Okay, can I have everyone in the chat here? Now the controversy is rectified, right? Now everyone is clear with the answer, cricothyrotomy. I want everyone to answer in the chat. Yes or no? The answer is cricothyrotomy. I hope everyone remembers this so that we'll go to the next question. Okay, good. Great that everyone understood this point. Okay, so the next clinical scenario, if you can see here, a 35-year-old male patient reported to the emergency. On examination, he is disoriented with proptosis of right eye and history of infection to his right upper third molar. What is the probable diagnosis? Everyone, please take time to read the question. Okay, please take time to read this question and answer the question. Okay, what is the probable diagnosis? Jaydev, I asked you diagnosis. What happened to the patient? What is the diagnosis for this patient? Probable diagnosis. What do you feel is the probable diagnosis for this case? Anyone else wants to answer this? No worries, just throw out your answers. That is completely fine. I understand it's a difficult question, okay, but that is what we are made of. Okay, we need to answer all the difficult questions. We need to learn all the difficult ones so that before we go to the exam, we'll be mentally very strong to face any kind of questions for us in the examination, right? Okay. Yeah, Rupsi Gupta has come really close to the answer. Retrobulbar infiltration through maxillary sinus infection. So, what is it called? There's a specific term for that, right? She has come really close to the answer. Maybe if I would have given options for you people, everyone would have answered it. That is completely fine. You'll get some options in the exams. So, you'll answer it in the exams, definitely. Yes, Jaydev, pterygoid infection is right. Pterygoid infection reaching the eye. What is it called as the probable diagnosis? Pterygoid infection reaching the eye. Okay, come on. Let's move. Okay, so the answer is cavernous sinus thrombosis, CST. Okay, cavernous sinus thrombosis. Okay, so the answer is CST or cavernous sinus thrombosis. Okay, let us learn a little bit about cavernous sinus thrombosis. Um, what are the criteria associated with cavernous sinus thrombosis? There is some criteria associated with cavernous sinus thrombosis. Can anyone tell here? Name the criteria associated with cavernous sinus thrombosis. This particular name for the criteria. There is one name. Yes, Ritu Bharti has answered it. It is called as Eagleton criteria. Okay. So what is this Eagleton criteria? We'll just go ahead. Okay. Because Ritu has told now it is called as Eagleton criteria. So now see this question. Which of the following is not included in Eagleton criteria? Known site of infection A, B, paralysis of third, fourth, and sixth nerves, C, evidence of bloodstream infection, D, none of the above. Can anyone answer this above the head for everyone? That is completely fine. You will learn something new today. Sorry. It's actually good to see a lot of people answering. Okay, the answer is D, none of the above. Don't worry, I'll be discussing about Eagleton criteria in the next slide. Okay, there will be no site of infection. There will be paralysis of third, fourth, and sixth cranial nerves, and there will be also evidence of bloodstream infection. Okay, so the answer is D. Okay, so if you see the Eagleton criteria, it is given in the year 1926. Okay, so the following are the criteria in the given to diagnose cavernous sinus thrombosis. Okay, a known site of infection. If you see the question there is no site of infection. The maxillary upper right third molar has infection. Okay, I've mentioned it in the question there. And there is evidence of bloodstream infection. Evidence of bloodstream infection means either there will be pyrexia, okay, or there will be some amount of um, leukocytosis. Okay, so there will be some evidence of bloodstream infection, and there will be early signs of venous obstruction in the retina, conjunctiva, or eyelid. Okay, that is a cause for the proptosis of the eye. Okay, because of the venous obstruction in the retina, conjunctiva. Okay, and then there will be paralysis of the third, fourth, and sixth cranial nerves. Okay, there will also be paralysis of the third, fourth, and sixth cranial nerves, and there will be abscess formation in the neighboring soft tissues. Means if it is a maxillary third molar infection, you can well see an abscess that is formed in the vestibule or somewhere. Okay, so there will be no site of infection. There will be evidence of bloodstream infection. There may be venous obstruction in the retina, conjunctiva, or the eyelid, or there can be paralysis of the third, fourth, and sixth cranial nerves and abscess formation in the neighboring soft tissues. Okay, so everyone clear with Eagleton's criteria, right? So, yes, okay, thank you. Okay, so I hope this lecture is clear to everyone. Okay, there can be more clinical scenarios on this. Okay, in the next lecture, as you have asked me, I'll discuss about drains and I'll also discuss about clinical scenarios. And I think one of you has asked me to discuss something else. I think some I'll just check in the chat. Okay. Some other topic was also asked for me. Yes, Prabhavati has asked, sir, if possible, please take a lecture on odontogenic cyst and treatment. Definitely, ma. Definitely, I'll take. Okay, there is a lot to discuss in odontogenic cyst and treatment. I'll keep it in my mind. Okay, because since I've started on space infections, I think 2 or 3 classes I'll continue with space infections. I'll see various clinical scenarios. I'll explain you. Okay. Okay, Muskan, you want OKC also to be discussed? Definitely, I'll discuss. There is so much consensus that has been achieved nowadays, and there are so many controversies on OKC as well, Muskan. Okay, one question I would want to ask you: is OKC a cyst or tumor now? OKC is a cyst or tumor now? Yes, okay, it is a cyst now. Okay, again, it is reclassified as a cyst now. Okay, so remember that thing. There's so much to discuss about OKC actually. Okay, so these are really interesting things. If you want, I can discuss well about the treatment part as well. Okay, so I'll keep it a note. Okay, I'll mention to the people managing also. So Definitely. We'll discuss now. Okay. So, thank you so much. Okay. If you have any queries, you can ask me or ping me in my Insta as well, or you can mail me there as well. Okay. So,